Welcome to the Deep Dive, the show that extracts the most important nuggets of knowledge to help you become truly well-informed. Today, we're diving deep into the intricate world of psychoanalytic treatment. We're moving beyond the neat textbook theories into what one expert, Lawrence Friedman, called the nameless, theoryless, shapeless, swarming interaction of actual therapy. Our source for this deep dive is a really compelling chapter from Freud and Beyond, a history of modern psychoanalytic thought. That's by Stephen Mitchell and Margaret Black. And our mission today, it's to navigate the major contemporary controversies in analytic technique. We're going to do this through really powerful case study, a patient we'll call Harvey. We'll trace how these core ideas, transference, the role of interpretation versus the relationship itself, and the evolving understanding of countertransference, how they've all been debated and transformed. It's quite a journey.
That's right. And what's so fascinating here, I think, is that these aren't just, abstract historical debates. Not at all. These are real-time dilemmas. They profoundly impact what happens in the therapy room, moment to moment, between a patient and an analyst. We'll define key terms like transference and countertransference as we go. We want to make sure you understand not just what they mean, but why these differing viewpoints are so crucial. Crucial for understanding how change actually happens.
Okay, so let's meet Harvey. He's an artist. Talented, definitely, but kind of held back by inhibitions in his work, relationships, sexuality, the whole package, really. And he'd actually had analysis before, 5 years, in fact. An ego psychology orientation, they call it. It did help him feel better, gave him some relief. And he became quite sophisticated about psychoanalytic concepts, used the technical language pretty skillfully. After his first analyst retired, Harvey grieved for a bit and then sought treatment again, this time with an analyst in training at a psychoanalytic institute.
Yeah, and his early life, it reveals quite a lot. His mother was bright, apparently, but suffered from these severe lifelong depressions. After his older brother was born, she was hospitalized for years, almost catatonic, the text says. She later told Harvey that having him was what sort of brought her back to life. So mothering Harvey became her absolute central focus. His father, less involved, left Harvey mainly in his mother's care. And Harvey, as a child, he didn't know about his mother's secret struggles, not explicitly. But he always sensed she was, deeply disturbed, extremely fragile. So he became a very good son, kind of surrendering himself to her anxious, overprotective care.
Right. And Harvey and his first analyst, they understood his difficulties as stemming from this really close, almost smothering relationship with his mother, and also from Oedipal fears, fears of his father's disapproval. The relationship with that first analyst was seen as a father transference. Harvey felt neglected, like with his dad, but he also had these fantasies about being a special, favored patient, something he never felt with his actual father.
So when Harvey started his second analysis, both he and his new analyst, they initially felt it was an ideal case. The analyst, who apparently felt a bit insecure sometimes with other patients, felt really competent with Harvey, clear about what to do. It just seems like a smooth continuation of the earlier work.
But this is where it gets really interesting. This is where Harvey's case takes this, unexpected turn. And it sparks these major controversies in technique. About 3 years in, Harvey, who was usually so cooperative, right? He started making these sarcastic jokes when he got angry, implying the analyst might actually be a janitor, not a real analyst, things like that. And he'd accuse the analyst of lacking a sense of humor if they tried to, take these fantasies seriously.
And more subtly, the analyst, as they gained more experience, started to realize something. That feeling of competence with Harvey, it wasn't entirely spontaneous. It felt orchestrated. Harvey always had fascinating topics, always some important feature he'd conveniently missed, right? Which then allowed the analyst to make this significant, insightful contribution. His dreams were described as unfailingly accessible, always providing clear cues for the analyst's interpretations, which, by the way, were always well received. The analyst realized, wow, Harvey is subtly guiding this whole thing.
Okay, so that realization really set the stage for this crucial incident. One day, the analyst makes a brief comment, uses a word Harvey doesn't know, an unfamiliar word, and Harvey becomes extremely anxious, really pressured. He eventually reveals this terrifying fear. He thought the analyst had just made up the word, like a schizophrenic neologism. This terrified him because, privately, he'd been worried the analyst was actually quite disturbed, and Harvey felt intensely protective. He was certain the analyst would be devastated if this craziness was exposed. He felt he'd failed the analyst, potentially destroying both the analyst and the treatment itself.
Yeah, and it took weeks, apparently, for Harvey to explain this fully. He revealed this deeper belief he held. He imagined the analyst had suffered severe psychological dysfunction, maybe even hospitalization, and dealt with it by going into the mental health field. Harvey saw himself as the analyst's favorite patient, the one who made the analyst feel most competent, most professional, least crazy. He believed only he knew the analyst's secret, and by keeping it, he was showing his love and support. His horror that day was in accidentally revealing that he knew. He was terrified it would shatter the analyst's confidence, and then the analyst would abandon him.
Wow, and what's truly fascinating here is Harvey's own analytic sophistication through all this. As they discuss his beliefs about the analyst, Harvey kept insisting, "This must have nothing to do with you. It's transference." He explained, "Look, my own mother was crazy. She used her helping role just to stay organized. He felt he had kept her together by being her good son." So all these feelings toward the analyst, he insisted they were just transferred from his experience of his mother. Okay, so Harvey's really intense reaction here. It forced analysts to re-examine a core belief. Was this just his past erupting into the present, like he insisted, or was something real happening in the room, right now, between them? This question really ignited what they call the past versus present debate in psychoanalytic technique.
Exactly. And in classical theory, well, Harvey would be considered largely correct. This model sees the analytic situation almost like a time machine. The patient's internal stuff conflicts, inhibitions from childhood, especially with figures like his mother. It all becomes manifest in the transference. The analyst is supposed to be this neutral operator, almost a blank screen, their personal qualities, irrelevant. So the analyst interprets the patient's current feelings toward them as disguised forms of feelings from the past. For Harvey, his fears about the analyst's craziness, well, they'd ultimately be understood as displaced from his experience of his mother. Any little cues from the analyst are just seen as inconsequential hooks for these old feelings. But then you contrast this with the interactional approach, which has really gained prominence over time. Here, the patient is seen as firmly engaged in the present. They're not just reliving the past in a vacuum. People acquire preferred forms of relating from early experiences, sure. But then they weave actual observations about the analyst into these habitual patterns. So Harvey's observations about the analyst's anxieties, maybe they aren't just distortions. Maybe they reflect his highly developed sensitivities, honed from his past with his mother. He learned that authority figures can be shaky, that they might need taken care of.
That sounds like a really profound difference. So what's the real implication of this shift for how an analyst should actually work with someone like Harvey? It seems like it challenges the very foundation of their role.
It absolutely does. The interactional model critiques the classical view on really three main grounds. First, it argues that the classical view arbitrarily makes the analyst the judge of reality, which is pretty questionable, right? Especially now when we understand truth is always interpreted, not purely objective. Second, it potentially undermines the patient's own sense of reality. It dismisses their unique perceptions, basically tells Harvey, no, your experience isn't valid. And third, and this is maybe the most critical point, it risks a repetitive reenactment of the very kind of warping relationship that caused the problems in the first place. If the analyst insists Harvey's experience of him as crazy is just a distortion, well, isn't that acting just like his mother might have, denying his perception? It kind of confirms Harvey's suspicion that the analyst is fragile and can't handle the truth.
Okay, wow. So if the interactional view takes these interactions as more real, what would good technique look like for Harvey then? What should the analyst do?
Well, it would necessitate a much more in-depth exploration of Harvey's actual observations about the analyst. The goal wouldn't just be to label it transference. It would be to track how he arrived at his conclusions. How does he process observations about others? The aim is for Harvey to learn, eventually, that the analyst's struggles, if they even exist, are different from his mother's struggles. And crucially, that they don't require his loving and hateful sacrifice, sacrificing his own authentic self just to maintain the connection. He needs to see a different, more resilient kind of person in the analyst.
This leads us right into another equally crucial debate, doesn't it? What actually makes change happen in analysis? Is it primarily the interpretation, the insight it generates? Or is the relationship itself the main curative factor?
That's the core question. Freud's original view really emphasized the lifting of repression through insight produced by interpretation. Simple enough, right? Problems stem from pushing unacceptable impulses, fantasies, memories out of conscious awareness, repression. The cure involved releasing these through interpretation. The analyst interprets the repressed stuff and also the patient's defenses against knowing it. From this classical perspective, Harvey's ongoing issues, even after 5 years of analysis, suggested that while he might have intellectual understanding, genuine deep insight hadn't fully taken place. But then you have James Strachey back in the early 1930s offering this brilliant counterargument, really sharp. He pointed out that Freud introduced the concept of the superego, our internal moral compass, the part that judges us, but he didn't fully integrate it into his theory of technique. Strachey argued, look, if you release forbidden impulses, but the superego, the part that considers them wrong or bad, remains untouched, well, the cure is just temporary. The superego will just keep pushing those impulses back down.
That makes perfect sense. A very sharp insight. So, how does the superego change then? This is where Strachey got really interesting, drawing on Melanie Klein's ideas.
Right. Strachey's genius was realizing how the superego is maintained. It's through this cycle of what he called projective and introjective processes. Patients basically project their harsh superego onto new people, like the analyst. They expect the analyst to be critical, moralistic, condemnatory, just like their parents might have been. Then they find little clues, maybe misinterpret things, to confirm this expectation. And they reintroject those experiences, which just reinforces the original demanding superego. It's a vicious cycle. Strachey's key insight was that transference interpretations have this double impact. The explicit message is clear. Your feelings for me right now actually come from your past relationship with your parent. But the powerful implicit message, the unspoken one, is, hey, I'm a different person from your image of that parent. I don't feel or believe the things you're attributing to me. The subtle implicit message disconfirms the patient's deepest, often unconscious expectations. It alters the superego by breaking that projective introjective cycle. The patient then internalizes features of the actual different relationship with the analyst, developing less rigid, less demanding attitudes toward themselves.
So, the analyst becomes this different kind of figure almost implicitly, just through careful interpretation. But Strachey mostly felt the analyst didn't have to do anything particularly special beyond interpreting well. This left a big question open for later theorists, didn't it? How exactly does the analyst become this different kind of object in a way that truly transforms the relationship? Is interpretation always enough?
Exactly. And that question led to various developmental approaches. Many theorists, like British object relations folks, ego psychologists, self-psychologists, they believed internalization happens well beyond the Oedipal phase. They argued the analyst could actually serve key parental functions that were missed earlier in development. Some, like Fred Pine, felt that just normal analyzing, being reliable, listening carefully, thoughtful interpreting provides this missing parental responsiveness and helps restart stalled development. But others, like Winnicott or Cahood, argue that sometimes the analyst really needs to do something different. Maybe offer extra sessions, be more available, respond in more individualized ways, create actual new experiences that address specific missed developmental needs, avoiding re-traumatization. Then you have the interpersonal tradition strongly influenced by people like Erich Fromm. They focus more on the adult-to-adult aspects of the relationship. Fromm believed that, because society is often so dishonest, patients deeply crave authentic honesty and engagement in therapy. What's curative in this view is the analyst's honest response within professional bounds, of course. This provides a freeing way for the patient to internalize authenticity, something they might never have experienced before.
Okay, let's bring this back to Harvey again. Imagine his analyst at that crucial turning point, right after Harvey revealed his fears about the analyst's craziness. How might these different approaches actually guide the intervention? What would they do?
Well, a strictly classical analyst might focus on interpreting Harvey's defense against experiencing feelings directly towards the analyst. Something like, right now I am the one you worry is crazy and fragile, and you seem to be having trouble staying with that experience. Then they'd likely connect it back to its historical origins. This feels like a reanimation of your fusion with your mother. The therapeutic action is seen as generating insight, releasing repressed wishes. Now, under Strachey's reconceptualization, you'd still have that insight component. But the analyst would also be very aware of the implicit message. I am not crazy like your mother. I can listen openly to these fears without being crushed myself. That implicit disconfirmation is key to changing Harvey's internal landscape. A developmentally based analyst might actually question that confrontational quality. They might feel the effectiveness of any interpretation hinges on the analyst first providing these fundamental, self-confirming parental responses, just careful listening, non-retaliatory interest. Or they might feel the analyst needs to do something different entirely. Maybe encourage Harvey's curiosity about the analyst as a real person to help establish the analyst as a truly different kind of caregiver. And finally, an interpersonal approach might lead the analyst to engage even more actively and directly. That initial insistence on pursuing Harvey's reactions was already a step in that direction. It might even involve, down the line, an open discussion of the analyst's own experience, what it felt like for them when Harvey was treating them as so fragile. That kind of authenticity is central. Hashtag the evolution of countertransference.
So just like our understanding of transference has evolved, the understanding of countertransference, the analyst's own emotional reactions to the patient, that's undergone its own revolution too, hasn't it?
Oh, absolutely. A huge revolution. Freud and the early classical analysts saw countertransference primarily as an obstacle, a problem. It was seen as the analyst's own displaced feelings, their own past getting projected onto the patient, something to be gotten rid of through more self-analysis. The ideal analyst was supposed to be calm, objective, a blank screen, or a neutral time machine operator. But over decades, there was this radical shift, a move from a one-person psychology framework to a two-person framework. Both patient and analyst are seen as constantly impacting the interaction. Pioneers like Ferenczi, Racker, and interpersonalists like Sullivan and Fromm were absolutely crucial here. They realized the analyst's reactions aren't just a personal flaw or interference. They're part of the dynamic field created between the two people. Fromm, for instance, believed the analyst's frank and honest reactions, professionally constrained, of course, were crucial analytic data. They offered patients a rare kind of truthfulness about how they actually affected others. So contemporary views building on this now see countertransference as a key domain and often a valuable tool. It's not just an obstacle anymore. You give a diagnostic compass, a way to understand the patient's dynamics, their interactional patterns, what they evoke in others.
Okay, so what do we make of Harvey's analyst's countertransference then? Remember, the analyst first felt gratified, competent, then anxious and exposed when Harvey revealed his doubts, and finally, both moved and maybe a little patronized by Harvey's intense caretaking.
Right, we can unpack those reactions using these newer frameworks. First, you ask, why did the analyst have these feelings? Some might say these are just ordinary common responses to the kind of interpersonal pressure Harvey sets up, what Winnicott called objective countertransference. Basically, how anyone might feel in that situation. Others might see it as a reenactment of Harvey's past relationship dynamics, with both analyst and patient participating unconsciously. Kleinians might talk about projective identification. Maybe Harvey was projecting his own deep fears about his sanity into the analyst, who then becomes a kind of container for these disowned parts of Harvey. A more fully two-person approach would extend this even further. It would ask, what responsive chords did Harvey strike in the analyst? What vulnerable parts of the analyst's own history or personality were evoked? In this view, deep analysis often involves these kinds of crises where both participants are implicated, and the real therapeutic work lies in constructively navigating that shared experience together. Some theorists even suggest exploring the patient's hypotheses about the analyst's experience, because patients often have incredibly discerning, though perhaps distorted, observations about their analysts. And the second big question is, okay, so what do we do with the analyst's feelings? This brings us squarely into the disclosure debate. Classically, disclosure was absolutely forbidden. It muddied the blank screen, contaminated the process, deflected focus from the patient. But today, many analysts argue for selective, judiciously chosen disclosures. They believe it can provide crucial information, enhance authenticity, and sometimes resolve difficult impasses. For example, an analyst admitting their irritation about a patient's chronic lateness, if done thoughtfully, might open up a whole exploration of power struggles in the patient's family history.
Yeah, that really changes the whole dynamic, doesn't it? You can imagine an analyst running 10 minutes late. A traditional, maybe more laconic style analyst might just proceed. But for some patients, that could feel like a horrible replay, maybe of being treated as unimportant or dismissed as a child. A new edition of callous and disrespectful treatment, as the text puts it. But an analyst expressing genuine distress about their lateness, maybe even sharing how it feels to them when the patient keeps them waiting sometimes. Wow, that could potentially open up a heretofore closed area in the patient's life. Maybe a disavowed wish to actually matter to someone, to have an impact. This active, engaging style seems like it could really deepen the process.
Absolutely. And many contemporary analysts now feel that the analyst often needs to do something more active and directly engaging to make their presence truly palpable, to make their emotional involvement effective, especially for patients like Harvey, who maybe struggled to imagine being important to someone outside of that rescuer or caretaker role. In Harvey's case, the text mentions his analyst was, at times, profoundly moved by Harvey's dedication, his willingness to sacrifice his own life, in a way, to help the analyst feel competent. And the analyst told him so. This allowed Harvey, perhaps for the first time, to feel he had mattered to and moved the analyst. This was apparently deeply liberating for him, leading to him renegotiating their relationship with much more autonomy.
So finally, this really rich discussion of technique, all these evolving ideas, it naturally leads us to a bigger question. What is psychoanalysis today? How does it even relate to other kinds of treatment? The very definition seems to have been shifting.
It really has. Historically, if you look at Freud's actual practice, it was often surprisingly flexible, even informal sometimes. But particularly in the United States, what became known as orthodox American psychoanalysis grew very formalized, very rigid, partly to distinguish itself professionally from other therapies that were emerging. It got defined by these strict extrinsic criteria. You had to have a minimum of 4 sessions a week, the patient had to use the couch, the analyst was anonymous, largely silent. These specific conditions were believed to be absolutely necessary for the full development of the patient's transference neurosis, that intense replay of the past, the trip in the analytic time machine. But the last few decades have brought really dramatic changes, driven by two main forces. First, as we've discussed, theoretical developments, especially the shift to a two-person framework. Once you acknowledge the analyst inevitably impacts the process, the rationale for rigid neutrality weakens. Different patients might need different kinds of engagement. This has led to much more varied practices. Fewer sessions per week, patients sitting up face-to-face, analysts using more active or expressive styles, even sometimes combining analysis with other therapies like behavioral or family therapy. And second, there are powerful social, economic, and political forces at play. The high cost of traditional analysis, pressures from insurance companies, debates about healthcare priorities, all these have pushed practitioners to broaden their practice beyond that traditionally structured, intensive analysis. It was increasingly seen as cost inefficient.
Right. So this brings us to a core and pretty hotly debated question. Should this shorter, less frequent, often face-to-face work still be called psychoanalysis? Or should we reserve that term and call these modifications psychotherapy?
It's a fundamental debate, really. It pits those who emphasize the extrinsic criteria, the setup, like session frequency and the couch, against those who focus on intrinsic criteria. The intrinsic view looks at the depth of the process. Is there a systematic exploration of transference and countertransference dynamics? Is there a focus on unconscious conflict and meaning? Some traditionalists still argue that truly deep analytic work requires those traditional settings to fully emerge, but others, like Merton Gill is a key voice here, argue that profound dynamic issues, the core transfers, countertransference interactions, these can emerge in many different circumstances. Provided the analyst is attuned and willing to engage them in that sustained collaborative inquiry, hashtag tag outro.
Wow, what a journey through the evolution of psychoanalytic technique. We've really seen how the core commitment seems to remain, hasn't it? A sustained collaborative inquiry into the complex textures of human experience, exploring that interplay of past and present, self and other. From the classical idea of the analyst as a neutral time machine operator to the much more dynamic two-person field, well, the understanding of how healing actually happens has transformed profoundly.
It really has, and if you connect this to the bigger picture, it really underscores that psychoanalysis, maybe at its best, isn't defined by the furniture or a rigid set of rules. It's defined by a particular kind of relationship, one that's committed to deeper self-understanding, finding a richer sense of personal meaning, and ultimately achieving a greater degree of freedom. For individuals like Harvey, it's about breaking free from those compulsive, repetitive needs and patterns and being able to live more genuinely, more authentically.
We really hope this deep dive has given you a clearer, maybe richer understanding of the profound complexities and the ongoing, vibrant debates within psychoanalysis. What stands out to you listening to this? How do you think these different approaches might actually impact a therapeutic relationship? Does acknowledging that swarming interaction change how you view what happens in therapy? Lots to think about.
Indeed. Thank you so much for joining us on this exploration today. Keep learning, keep questioning, and definitely keep engaging with the fascinating, ever-evolving world of psychological thought.